Welcome to the deep dive. You're here because you want to get smart fast.
Uh-huh.
We take those overwhelming piles of information and, pull out the crucial insights, the stuff that actually matters for you.
Exactly. Get right to the point.
And today, we're laser focused on boosting quality in healthcare. We've sifted through info on some big players and also a pretty neat tool that can really help.
Yeah, we're diving into Joint Commission International JCI, also NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers,
Right.
and ASHOSQA, the International Society for Quality in Healthcare. These are some heavy hitters shaping healthcare globally.
Definitely. And like you said, there's that tool, the Pareto Principle, the 80-20 rule people talk about.
That's the one.
Yeah.
We'll unpack how it can help you sharpen your focus, figure out what really drives improvement.
Okay, so our mission for you today is pretty straightforward. We want you to get a clear handle on these key organizations, who they are, what they do, why they're important.
And crucially, equip you with that practical side, the Pareto Principle, so you can start thinking about how to prioritize your quality efforts.
Sounds good. Okay, let's unpack this, starting with maybe the biggest global force, Joint Commission International, JCI.
Right, JCI, they've really been a leader in, healthcare quality and patient safety for, over 20 years now?
Yeah, quite a while.
Their mission is pretty direct and ambitious
Yeah.
to enable and affirm the highest standards of healthcare quality and patient safety for all.
And their reach is just, wow.
It really is. They work with healthcare organizations in over 70 countries: Asia, Europe, the Middle East, Africa, Latin America.
It's huge, spreading standards globally.
Yeah, and they've accredited and certified over 1,000 programs already.
So it's a massive footprint. But it's not just about handing out badges, right? It looks like they offer a lot more to actually help organizations get better.
Oh, absolutely. Accreditation is core, yeah, but they do so much more. Certifications for specific clinical programs, even things like healthcare sustainability, telehealth.
Which are becoming so important now.
Exactly. And then there are advisory services. This is key for people listening. If you're facing a challenge, say, with infection prevention, knowing JCI offers specific guidance isn't just academic. It means there's a structured, internationally recognized framework you can tap into.
Saves you reinventing the wheel.
Totally.
Yeah.
They help prep for accreditation, sure, but also with quality management systems, patient safety, meds management, facility safety, emergency planning, even writing policy.
So, if my hospital needs to beef up its emergency plan, JCI could offer best practices.
Precisely. And it's not just advice. They actively push for high reliability in healthcare. They do assessments, training.
High reliability, that's a big focus these days.
It is. Plus, they have online tools, loads of publications, manuals, books. Their newsletter, JC Insight, keeps people updated. They're constantly sharing what works.
It really sounds like they don't just set the standard, they actively help organizations climb up to meet it. And they're the ones behind those big international standards, including the international patient safety goals, right? Which are foundational everywhere.
Yeah, those IPSGs are critical. And what's powerful is the sheer range of resources. On-demand webinars on tons of topics, that newsletter we mentioned.
JC Insight.
Right, and they host big events like Unify 2025, bringing folks together to tackle the tough challenges in healthcare. It builds a real global community feel.
Yeah, that sense of shared purpose. It's always good to hear from people who've actually gone through it. We saw some feedback from a CEO at Hong Kong Adventist hospitals.
Oh, yeah. What did they say?
Called the JCI process, one of the best team-building exercises. Said it really improved coordination and communication, kind of an unexpected benefit,
That is interesting. It shows it's not just ticking boxes. It can actually change the culture.
Exactly.
We also saw a comment from a senior quality officer at Brazil Farha Hospital. They mentioned reaccreditation gives them a competitive edge, builds community trust.
Makes sense. Public perception matters.
And they highlighted better risk management, a stronger patient safety culture. That really hits the bullseye, doesn't it?
Absolutely. Better internal work, more public trust. Emirates Specialty Hospital mentioned the JCI Gold Seal, adding real value, boosting patient confidence.
The gold seal, yeah.
Yeah.
That's the recognizable mark.
And then Corniche Hospital, getting it for the 6th time, talked about their ongoing dedication. It really shows quality isn't a one-and-done thing.
No, it's definitely a continuous journey, constant commitment.
Okay, so that's JCI. Now, let's pivot slightly. The National Accreditation Board for Hospitals and Healthcare Providers, NABH, more specific geographically, this one.
Yes, exactly. NABH is part of the Quality Council of India. So while JCI is global, NABH was set up specifically for accreditation within India.
Tailored to the Indian context.
Right. Their main goal is meeting the needs of Indian consumers, setting benchmarks for the health industry there.
So national scope, but the same underlying goal, improving quality and safety. And they operate independently.
Yeah, the info says they get support from stakeholders, industry, consumers, government, but have full functional autonomy day to day.
Which is probably important for credibility.
Definitely. It lets them tailor programs to India's specific healthcare landscape and challenges. Like JCI, they offer accreditation and certification, but focused within that Indian framework.
Got it. So JCI, Global, NABH for India. Now let's bring in the third one, ISQA, the International Society for Quality in Healthcare. This one sounds a bit different, more member-driven.
That's a key distinction, yeah. ISQA is member-based, not-for-profit, again with a global view on improving healthcare quality. They've been around a while, too, over 30 years.
Long track record.
Their mission: inspiring and driving improvements in the quality and safety of healthcare worldwide.
Inspiring and driving. I like that. It suggests more than just rules. How do they actually do that?
Well, several ways. Education is huge for them. Sharing knowledge, best practices. They also do external evaluations, their IEA program. International External Evaluation Association. They support health systems and, maybe most importantly, they connect people. Professionals working in quality.
Building that network.
Exactly. Their network spans over 70 countries, so it's a real international collaboration hub.
So, building communities, spreading good ideas, what kind of specific things do they offer?
Quite a lot, actually. Membership options, obviously. Big international conferences, São Paulo in 2025 on inclusive health systems, Dublin in 2026.
Always good to connect in person.
For sure. That IEA program provides assessment frameworks. They have education programs like a well-regarded fellowship program.
A fellowship. Interesting.
Yeah. For individuals really wanting to deepen their expertise, they have communities of practice networks focused on regions or specific topics, and publications, too.
Journals?
Yep. The International Journal for Quality in Healthcare, IJQHC, and another, IJCOMS, on care coordination. Plus, green and white papers on key issues. So if you're thinking professional development, the ISQA Fellowship might be worth a look.
Right. So ISQA sounds like a central hub for learning, connection, pushing the field forward. And the recent news seems pretty active.
Oh, yeah, very dynamic. Conference announcements, recognizing leaders, new resources, publications, weighing in on current global health stuff. They're clearly deeply engaged.
Okay, this is great. We've got a good picture now. JCI driving global accreditation and improvement, NABH focused on India, ISQA fostering quality through learning and connection worldwide. Now, for everyone listening, the big question: how do we take all this, these big organizations, and actually use it on the ground, make real improvements day to day?
And that brings us nicely to the Pareto Principle.
The 80-20 rule?
Exactly. JCI, NABH, ISQA, they provide the frameworks, the standards.
Yeah.
Pareto is a tool, a powerful, surprisingly simple tool that helps organizations figure out where to focus.
Whether you're going for accreditation or just trying to get better.
Right. It helps you direct your limited resources, time, money, effort for the biggest bang for your buck.
So for anyone maybe not super familiar, can you give us the quick lowdown? What is the Pareto Principle?
Sure. So the Pareto Principle, or the 80-20 rule, it basically suggests that roughly 80% of the effects you see come from only about 20% of the causes.
80% from 20%.
Yeah. It's named after Vilfredo Pareto, an economist who noticed this with wealth distribution in Italy way back when.
Yeah.
But the amazing thing is how often this pattern shows up.
In all sorts of areas, not just economics.
All sorts. And what's really useful is how it can uncover hidden inefficiencies, bottlenecks you might not see otherwise. It forces you to look at the data, not just intuition.
Okay, so how does that translate specifically to healthcare quality improvement? What does 80-20 look like there?
Well, it often means that something like 80% of your problems, maybe patient complaints, medication errors, whatever, are probably driven by just 20% of the underlying root causes.
Ah, okay, so find that critical 20%.
Find it, focus on it, and you can potentially solve the vast majority of the problem. Much more efficient than trying to fix everything at once.
Right, target the vital few causes instead of spreading yourself thin across the trivial many, so to speak.
Precisely. Focus your energy where it counts most. If you have tons of patient complaints, Pareto suggests a few key issues are likely driving most of them. Find those issues.
And how do you actually find that vital few? That's the Pareto analysis part.
Exactly. Pareto analysis is just the process. Identify the problem, collect data on the causes, categorize those causes, and then rank them by how often they occur or how much impact they have.
Rank them. And then you visualize it.
Yeah, usually with a Pareto chart.
Okay, walk us through a Pareto chart. What does it show?
It's basically a bar graph. Each bar is a cause, and they're lined up left to right from the biggest cause down to the smallest.
So the biggest problems jump right out at you on the left.
Right. And the key thing is it usually includes a line, a cumulative percentage line running across the top.
Cumulative line.
Yeah, it shows the running total. So you can easily see, okay, the first bar accounts for 40%, the first two together account for 65%, the first three hit 80%. It visually points you to that 80-20 cutoff.
Ah, I see. Makes it super clear where to focus first. That visual is powerful. Can we think of some concrete healthcare examples? How is this used day to day?
Oh, tons of ways. Let's say a hospital wants to cut down medication errors. They'd collect data on all errors for a while, then categorize them: wrong dose, wrong drug, wrong route, missed dose, whatever.
Right.
Using Pareto analysis, they might find, say, 70% of all their errors are due to just one thing: incorrect dosage calculations.
Wow, one category causing that much trouble.
Exactly. So, boom, that tells them precisely where to focus improvement efforts: better training on calculations, double-check systems for doses, maybe new technology. That's where they'll get the biggest impact.
Makes total sense. Focus the fire hose where the fire's hottest. We actually saw a great example from that podcast, the QI Playbook, about lab samples getting rejected.
Oh, yeah, the lab sample one. That was clear. They found, was it 32% rejected for incomplete forms?
Right, 25% for improper labeling.
0.18% delayed transport, 15% wrong containers, only 10% hemolyzed.
And the punchline was just fixing the forms and the labeling those top two could potentially solve 57% of all rejections. Half the problem just from two causes.
That's the power of it right there, pure 80-20 thinking. And they had another one, didn't they? Pediatric ICU.
Yeah, PICU incident reports. They had like 12 categories of incidents, but found a whopping 74% came from just two types: IV lines getting dislodged and feeding tubes being misplaced.
74% from just two things.
Crazy, right? So they focused interventions right there, standardizing how IVs were secured, extra training on checking feeding tubes.
And the result?
A 50% drop in total incidents in just 2 months.
Wow. See? That's proof positive. Targeted effort, massive results.
It really shows how this data-driven focus works. Leads to quick wins, supports deeper analysis like root cause analysis, fits right into PDSA cycles.
Absolutely. Once Pareto points you to the big hitters, then you can dig deeper into why those are happening and test solutions using things like PDSA cycles. Plan to Study Act.
So for hospitals aiming for those high standards from JCI, NABH, ISQA, Pareto seems like a must-have tool, doesn't it?
Well, completely essential for practical QI work.
Where else in a hospital might you commonly see it used?
Oh, lots of places. We mentioned med errors, lab samples. Analyzing patient complaints is a big one. Find the most common gripes.
Improve patient experience that way?
Exactly. Tracking sources of hospital-acquired infections, finding bottlenecks in admissions or discharge, analyzing surgical errors or near misses, looking at inventory waste. It's super versatile.
Basically, anywhere you have problems, you can categorize and count.
Pretty much.
So if someone listening wants to start using this in their own setting, what are the concrete steps, actionable takeaways?
Okay, step one, absolutely crucial. Get good data. You have to track and categorize the issues you care about. Errors, feedback, delays, whatever it is. Do it consistently over a set period.
Start collecting and organizing, even if it's small scale at first.
Yeah, even starting small can give you insights. Just be consistent. Step two, make the Pareto chart.
Visualize the data.
Right. Use Excel, Google Sheets, specific QI software, whatever works. Get those bars ranked, add that cumulative line, make it visual.
Okay, data collected, chart made. What's the final critical step?
Act on it. Focus your energy, your resources on fixing the top one or two causes, the ones the chart clearly shows are causing most of the trouble.
The vital few.
The vital few. Design specific, targeted fixes for those first. Don't try to boil the ocean. Get the biggest impact with focused effort.
That makes so much practical sense. We also saw that mention Supremediq consultancy, using tools like Pareto to help hospitals with things like NABH accreditation.
Right. It shows this isn't just theoretical. Consultants and organizations are actively using these tools to drive real change and help hospitals meet those accreditation standards.
Yeah, it connects the standards bodies with the practical tools needed on the ground. Okay, so wrapping this deep dive up, it feels really clear that understanding these organizations, JCI, NABH, ISQA, is vital if you're serious about healthcare quality and safety.
Definitely. They set the benchmarks, provide the frameworks, foster that global community striving for excellence.
And then having practical tools like the Pareto Principle is just as critical. It's the how.
It really is. It offers that focused, efficient way to translate those high standards into tangible, real-world improvements by hitting that 20% of causes driving 80% of problems.
You get significant sustainable change. Good for patients, good for the system.
Absolutely.
So for you, our listener, as you head back to your work, maybe take a moment, think about a challenge you're facing right now. How might that 80-20 rule apply? Could focusing on just one or two key drivers, the vital few, unlock some real progress?
It's a lens worth applying almost anywhere, isn't it?
It really is. And in healthcare, where quality and efficiency are so critical, it could be a genuine game changer. Thanks for taking this deep dive with us today.